Hello, Vikes. Um, Today we're going to go into mental health conditions, and I'm just going to do a brief skim of the surface, just so you can kind of get an idea for some of the diseases and disorders that exist. But one thing that you need to understand as someone who is potentially going into healthcare is a mental health condition is the same as having a physical health condition. There should be no shame surrounding getting a diagnosis. So, in fact, a diagnosis should feel powerful. So, if you get a diagnosis that is a mental health illness, or if it's a physical health illness like diabetes, it should feel the same. If you get the knowledge that this is what's happening within your body, well, that gives you power, because then you can work on a prognosis, which is a plan for feeling better, which is the whole point of healthcare. So, if you're going into healthcare, let me just emphasize that it is not your place to judge people. And if that's the kind of person you are, I would discourage you highly from going into healthcare. Okay, so some quick stats on this. About 20% of adults experience a mental health condition every year. 1 in 17 lives with a serious mental illness, such as schizophrenia or bipolar. Half of mental health conditions begin by age 14, and 75% of mental health conditions develop by age 24. So in many instances, you guys are in the age range where these disorders could be discovered. So briefly, we're going to go into just a skim of the surface. So I'll probably just give you a definition. In some cases, let you read what's on the slide while I talk about it. But you are going to pick a mental illness or a mental disorder that maybe you're familiar with, maybe someone in your family has, maybe one you're just fascinated by. And I don't care what the reason is. You get to pick. You certainly don't have to lay out why you picked it. But I want you to, when we do these different projects or we're looking into diseases, disorders, make it relevant to you. So if it's something that maybe you think your friend's experiencing, or you're experiencing, or someone in your family is experiencing, study it. Study it so you can have a little bit of a firmer grasp what it means. Just kind of do a quick fun facts, Vikes. With ADHD and every mental illness or disorder, there will be some differences between the genders in how they experience it. So as an example, in ADHD, the hyperactivity portion might be a little more pronounced in, say, boys than girls. With girls, it's underdiagnosed a lot of times because there is no hyperactivity, or generally not as much hyperactivity with girls, but they tend to be more like daydreamers and sort of distracted learners, where you might see in both cases, you might have both of them sort of interrupt in a conversation and things like that. So kind of look at gender differences like that. So that was a fun fact. Boys and girls can be different. Okay, there are anxiety disorders. And this usually, when they diagnose somebody with, say, anxiety or depression, it usually is a certain period of time. So if it was a day that you felt anxious, that's not going to be a sign of an anxiety disorder. But if it was a prolonged period, then it likely would be. And in many cases with anxiety disorders, a person may show up in a clinic or a hospital feeling like, oh my gosh, I'm having a heart attack. And if you look at the signs of a panic attack that's here on the slide, heart palpitations, nausea, sweating, the numbness and tingling is a sign of a heart attack in a lot of cases. So they can misconstrue it as, oh my gosh, my heart is having issues, when in reality what they're having is a panic attack. So that can happen with people in anxiety disorders. Again, look at gender differences. Also look at maybe famous people who suffer from this, so you can start to put faces with disorders to see, like, it's people in the public eye are getting a little bit better at saying, this is something I suffer from, and kind of changing the way we think about our mental health. So there are more extreme disorders that you can study. Bipolar is one of those. If you've ever seen Terminator with Arnold Schwarzenegger, the lady in the movie, Sarah Connor, is it Sarah O'Connor or Connor? Anyway, the actor that plays her has bipolar, and I remember watching an interview with her where she said in her manic phase, she could put a to-do list together like no other. She could just be like, I'm going to accomplish this. And she said I absolutely would accomplish everything, and I could do anything. I felt like I could do anything. But then when she had the depressive phase set in, it was the complete, obviously polar opposite, where she couldn't get herself out of bed. She felt like life wasn't worth it, those kinds of things. So again, look at gender differences, look at some people that maybe you have loved in entertainment that maybe have this one. This is one I remember reading. Angelina Jolie has borderline personality disorder. So there's maybe a famous person you could research if you wanted to take on this one. This one often gets misdiagnosed as bipolar. It affects more girls than boys, and in many of the cases with these personality disorders, it can stem from maybe childhood trauma or childhood neglect, and chemical changes can occur after those things happen. But look for this one to have like really stormy relationships. And we'll talk about treatment of different mental illness at the very end, although it's going to be very like skim the surface. I want you to actually do the rubber meets the road work. Okay, depression. I was reading an article recently that went into this pandemic and basically said it doesn't matter where your mental health was to begin the pandemic. You could have been really healthy in the beginning, or maybe you were bad at the beginning, but they've seen a decline in mental health in nearly everyone, and many of them experiencing some extreme depression, which makes sense to me if we're trapped in our houses and wearing masks all the time. It just doesn't feel natural and normal, and it can affect our mood. It can affect our mental state. So generally there's a time frame here, and I do want you to kind of acknowledge that there's a time frame, because some days you just feel bad, but the next day you can feel up and fine. So that's not necessarily depression, but if you experience it over weeks or just a longer period, then that's a good time to see someone and make sure that the chemicals in your brain are working right, and maybe even some talk therapy to kind of get through some of the things that you're going through. So depression is one you can look at. Now, this is one, if you were to say like, what's the biggest eating disorder in America? Not much attention is given to the fact that it's just binge eating. So binge eating is actually a mental health disorder. So if a person eats to the point of discomfort often, and it's kind of an escape mechanism, is just to eat and eat, they won't necessarily have an answer for getting rid of those calories. They'll likely become overweight or obese, and it's that's the high. If you were to say like which eating disorder is the most prevalent, it's binge eating disorder. So no answer for calories, just overeating, because food somehow gives you some, it can satiate not just your appetite, but also somehow change chemicals in your brain. So binge eating disorder is one. I'm sure you've heard of anorexia. Generally, anorexics will just not eat. They sometimes will not eat for a long time and then maybe have a binge eat because their body is just screaming for calories, and they will in some cases vomit, but generally they're the ones that just aren't eating. With bulimia, generally there's a binge followed by some way to purge, and that purge can be vomiting, or it can be using laxatives, or it can be obsessive exercise to get rid of the calories. They're all body image disorders. There's one that's affecting boys now. a little more than girls. It's called muscle dysmorphia, sometimes body dysmorphia, or maybe you've heard of it as bigorexia. So guys that are obsessed with symmetry and low body fat, people that will miss, say, a Christmas party with cousins because it's leg day, that kind of thing, could be a sign of a mental health condition, a body image disorder that actually needs some attention and help. So obsessive compulsive disorder is another one that you could maybe cover. Many times with this, so you've got the loop here on the picture where it kind of goes, okay, you have this obsession. So maybe you cooked eggs and you turn the stove on and you have anxiety because you're like, oh, did I leave the stove on? And then the compulsion is to just go make sure you turned it off, and you feel relief from that person. I shouldn't say you, but your person will feel relief from that. But then the obsession will come back. And even though they had checked it in their head, they're like, did I turn it off? They'll have to go back, and sometimes go back several times before the cycle feels like there's actual relief. So it's repetitive, it's unwanted, intrusive thoughts that lead to certain actions. So that's one that you can do. PTSD, generally, if a person has experienced some kind of trauma, like military combat, or they've been physically assaulted or molested or raped, or in the event that maybe they were in a natural disaster like an earthquake or a hurricane or something like that, sometimes noises or just regular things in life can trigger the memory and can cause the brain to shut down a little bit. So this is one that you can research. They kind of think of the 4th of July. They talk about veterans a lot of times having issues with PTSD, and hearing sounds like the fireworks sounds trigger memories from military combat. So those can be pretty damaging to a person. Schizophrenia, this is one they can have hallucinations or delusions, or a lot of times they'll be super paranoid, maybe buy into conspiracy theories, kind of a things, but it's extremely disordered thinking and behavior. This is one that's pretty extreme, but this is also another mental illness that you can cover. So I kind of leave that as a quick overview because, again, I want you to actually research it, and I'm gonna find a way that you can actually look at each other's, or I might even have you present depending on how this goes. But understand that mental illness can be treated, and I want to tell you from my own perspective. I'm your intro to health science teacher. I've been to therapy. I've had basically like psychologists talk me through problems in my life. There've been certain areas where I've struggled a little bit more than others, and I have no shame in telling you that I have been in therapy. I've been in multiple times, and I find it to be very helpful. I find it to help me kind of get a plan for my life. And like I was saying in the beginning, it might not even require a mental illness. If you're in a phase where you just can't pull yourself up, sometimes it helps to just talk to somebody that has no vested interest necessarily. I mean, they do in some ways have vested interest in your outcome, but they're not actively involved in your life. So you could talk to someone you trust, of course, and you should. But psychological therapy, they have the training to help you get to a healthier place. And I can attest to that. I can tell you in my own life, it has helped me, and I feel like a better person for having been to therapy the times that I have. So I'll put the assignment out there, and you guys will also research treatment. So In some cases, there may be a chemical imbalance in the brain, and so medication may be required. And they do have community support programs for specific mental health illness and different disorders. Let's say that a person is anorexic, they do have groups for anorexics, so they can talk about the similar issues that they have and have kind of group think about how to deal with those things. The main driving point that I want to leave you with today is we have to destroy the stigma surrounding mental health. So a stigma is a mark of disgrace associated with a particular circumstance, quality, or person. Do not dismiss a human being as being crazy or unstable or anything that kind of brings, I guess disgrace is a good word, to a person's health scenario. So in healthcare, it's our job to treat the patient, whatever that ailment is. We should look at it without judgment and with the idea, the outcome, trying to improve their lives. So if we're sitting back going like, crazy, that's not helpful. Not only is it not helpful, I'm just going to be straight with you. If you are the type of person that is judgmental towards certain segments of society or towards people who maybe have mental health issues, you do not belong in healthcare. That's the bottom line. So we have to treat patients with the idea that our goal is, how can we make your life improve? How can we make your health improve so that you can reach your full potential, essentially? So I'll leave the assignment out for you, and I will see you on Wednesday.